Hi, I'm Dr. Ronald Fielden.
I'm Dr. Michael Golab.
And we want to welcome you to South Texas Non-Surgical Spinal Center.
Dr. Golab, how long have you been using spinal decompression here at South Texas Non-Surgical Spinal Center?
About 4.5 years now.
What types of cases do you treat with spinal decompression?
With us, the most severe low back disc pain, the disc bulges, radiating leg pains, that's pain that goes down your leg all the way into your toes, classic sciatica, which everyone's heard of, just everything and anything with the lower back. So you don't have to have a disc bulge, but for prevention, it's good to treat it with the decompression unit.
Dr. Fielden, could you tell us about some of the cases you've treated with spinal decompression?
You know, it varies, and that's the neat part about it. We've treated a 18-year-old patient with a acute disc herniation that they got in sports and saw amazing results. We've also treated an 86-year-old patient who has diabetic neuropathy and all these other complicating factors who had amazing results. And we've had several of our elderly patients throw their canes away after just a few treatments, which has been a real pleasure to see. Once again, it's a results-oriented practice, and my favorite thing is seeing the results. And spinal decompression, by far, has created some amazing results with people who have spinal stenosis or disc injuries in their back.
Dr. Golab, what about people who have already had surgery? Are you able to help them at all?
Absolutely. As long as they don't have any hardware, which sometimes they put nuts and bolts in the lower back, we can get them safely and treat them well on the decompression unit.
Are there any particular cases that stand out in your mind as having had really exciting results?
Yeah, just as of late, we've had two preachers, one retired, one active, just by coincidence. They're both preachers who had severe low back pain. Both of them were pending surgery at the time, and this was their last stop. And one preacher had the cane, came in, he no longer has the cane, and that was after the second visit, and he's pretty much 99% better now, no medication, nothing. And the other one, who's the active preacher, is pretty much, he's almost through the program, and he's about 80% better now, no medication.
I know that you use the DRX 9000 machine, and I was wondering why you chose that particular unit, because aren't there some less expensive machines that maybe might be more profitable for you to use in your practice?
Yeah, but it's not using a traction machine and using a decompression machine are two different things. And there's really only two decompression units. One is called the VAX-D and one's the DRX 9000. And the reason why I chose the DRX 9000 over the VAX-D, it wasn't a cost issue, it was a positioning of the patient. The DRX comfortably lowers you down into a laying position and gets you back up once you're finished treatment and you're laying on your back. And it's very comfortable for most disc patients. Whereas the VAX-D, you're laying face down and you're holding on for dear life during treatment. It's just as effective, it's just not as comfortable. And as far as with getting a cheaper machine, we have traction units. It's just a rope on a pulley, and that is not decompression. So, you know, these doctors who have these machines that are $6,000, $7,000, it's not going to do the same thing as a $100,000 machine.
Dr. Fielden, for someone who's already having a lot of pain from a bulging disc or something of that nature, I would imagine that they might have concerns about the treatment being painful or causing more harm to them. What would you say to someone like that?
The nice thing about the DRX 9000 is that it is very low force and very non-invasive treatment. There's no cracking, there's no wrenching of the back. It's a very gentle procedure, and matter of fact, most of our patients sit and watch a DVD while they're getting treated for the time they're on the DRX. Fraser, Friends, Raymond, any of those DVDs, and we hear a lot of laughing coming from the room as they watch their DVD. It's a very gentle treatment, and those people out there who are hurting, who are afraid of having their backs twisted, this is certainly the type of treatment that you're looking for. It's a very mild force treatment.
Dr. Golab, how is insurance handled in your office?
Actually, this is my wife. My wife actually does all the billing, and she's doing the slaving and re-verification of insurance benefits, etc. But we are in network here at the office with all the major carriers and the minor carriers to include Medicare. As a courtesy to all our patients, when they come in, we verify all the coverage so that before they start any treatment, they will know what the responsibility is 100%, whether how much they're going to pay and how much the insurance company is going to pay. But most people just want to, see if we can help them here at this office.